Student journalists recently traveled to Kenya to learn about the response to the COVID-19 pandemic, including our very own Alfonso Valdivia. Here's what he learned.
It really caused a lot of psychological trauma. We lost professors, we lost medical officers, specialists, nurses.
This is Daniel Were, a nurse and a national COVID-19 treatment manager. He was the national coordinator of Kenya's National Treatment Center for COVID-19.
Here in the U.S., the beginning of the pandemic took us all by surprise, including our hospitals and our frontline workers. But how is this experience different on the other side of the world?
In Kenya, one of the most important countries in Africa, the first case of COVID-19 was reported on March 12 of 2020.
It came without a notice. There was no preparation for it.
In Kenyatta National Hospital, the biggest referral hospital in East and Central Africa, was where he, as the coordinator of the National Treatment Center for COVID-19, faced various challenges to keep control of the situation. The biggest challenge was getting enough staff to treat the patients.
Most of the staffs were not ready to work in this isolation because of fear. No one wanted to take the challenge. Yes, because they feared that they will contract the disease and die like the other colleagues. It required a lot of sacrifice and a lot of convincing for people.
Another challenge was getting enough supplies to work and treat patients, since their biggest source of supplies was the epicenter of the virus.
The materials that I use are from China. Then you see China had the biggest numbers of patients, and so even their supplies were now limited, what we could get.
Also, the cost of care was a problem. People were running out of money and had to start coming to public hospitals.
This disease was indiscriminate. It was not going for the rich. It was going for everyone.
And the situation only got worse with the lack of supplies and the increase in cases. Now people couldn't start breathing on their own.
So many people suffered the respiratory complications, whereby they required a lot of oxygen, and the supply was limited because there was only one source. We could not manage to contain the oxygen demand.
And that led to an isolation problem of patients.
The numbers kept on growing with little places to isolate.
That caused a challenge of transmission and exposure, since the Minister of Health brought in the home-based care concept.
Whereby now the community were to take care of the sick people who are infected and manage them at home, living with them.
This caused a quick spread of the virus that also affected health personnel.
Those are the saddest moments that we had as the medical fraternity, because some of the best brains were lost during that COVID pandemic. We lost professors, we lost medical officers, specialists, nurses. In fact, this institution lost some of the senior medical personnel.
And for this reason, he never gave up. He will always be ready to take care of new patients, since he says that even though the worst has passed, COVID is not over yet.
The thing is that COVID-19 is still with us. Yes, in the environment. Yes.
This is Alfonso Valdivia, Murrow, News 8.
WSU students can expect shorter syllabi starting next semester.